a wedge, right?
Yeah, so my babies, one of them had horrible reflux, so he was on Prevacid when he came home, and so I bought this for them. They mostly, definitely after feeding, half hour, they're always on an incline. Because the first week Nayland was home, I had my husband feed him and take care of him while I run to the NICU to see the other one. And I come home and he had just been fed, but I think he laid him flat and he choked on his spit up, turned blue, called 911, back at the emergency room at Cedars, but he was fine. But it's because he was, so this thing is the best thing that ever happened to me, by the way. I have 2 of these. And they're always on this thing. There's a seat belt, you strap them. Of course, supervised, not just leaving them alone. But this thing is the best. And then if you're worried about the head getting flat as they get older, because my kids spit up until they're like 2. So, I'm always like worried and making sure they're like upright. So this one is really good. It's soft, like their little head can kind of, the back can kind of go in that hole so it doesn't completely go flat if you're worried about the head being flat. And then as they get bigger, then it's this one. So they're kind of laying on this, but the back is flat.
And that's okay with you? Because even in the
Supervised.
even in teeters, they told us we shouldn't get that.
No, so it's not recommended, because developmentally they're supposed to be on the back of their head, but you can probably tell that babies are developing a preference of which direction that they want their head to be in. And you could position them so their head is the other way, but you'll come back and the head is going to be in the place where you definitely don't want it to be. So there's different positioners to help with that, because if you allow that to continue, they're going to get oddly shaped heads.
One of the trouble is we have to go to PT now once a week because he got torticollis.
Oh, yeah.
Really bad. Like his chin does not touch like this.
Yeah, so now the muscle's overdeveloped on that side. Yeah, and so you're going to have to kind of keep stretching it out in order to counterbalance it.
Roll a little towel and put it, and I'm like, it's not really doing
No,
This
it's not. It's not.
These little things will be better than the towel, like in terms of for his head shaping, because he won't be able to turn it against the bulk. You know what I mean?
Okay.
As a yes, we say put a little towel, but those things
And
really.
we like every hour and like make sure the towel's still placed in. It's not. River's tiny, but he's so strong.
Yeah.
They are. That's the thing.
That's how
They're strong.
my smallest one is like that. He's so strong, he's so tiny, and he had torticollis until he's about a year.
What did you do for it? Did you
PT. He had PT and OT like 3 times a week. If they tell me it's 1 time, I ask for 3. I'm pushing, because I'm like, no, 1 time a week, it's not gonna happen.
Right.
So everything they tell me what's recommended, I triple it, and I push to triple it. And they gave it to me after a while, but now they're starting to graduate out of some of the therapies, but after they turn 3 and regional center no longer covers, I'm like, I'm just still, pay for, I gotta,
One of the future talks we're going to have is about navigating the regional center.
Yeah.
And if you don't like your therapist, like what you do.
Okay.
And there's so many topics to cover. We're trying to cover like the basics, but we're definitely in the future going to have the whole regional center thing.
or call me if you have any questions. Okay. Okay.
So reflux, I'm sure you guys probably, some of you have heard me say this before, but reflux is going to be kind of a reality for the babies until at least about 9 months. So when you swallow a food bolus and it goes in your mouth and then it starts going down your esophagus to your stomach, between your esophagus, the tube that goes down to the stomach, and the stomach, there's a sphincter. And that sphincter is not under our control, just like the sphincter in our anus can not be under our control for babies, right? And for adults, it's a little bit more under our control sometimes. So what happens is that as you start swallowing, your stomach senses that food's about to come, it opens up, lets the food go in, and then afterwards that sphincter is supposed to get really tight so that when the stomach starts churning to break up the food, it doesn't go shooting back up. In all babies, 100% of babies, whether preterm or full term, that sphincter is loose. And it doesn't tighten up until at least 6 months to 9 months in a full term kid and 9 to 12 months in a preterm kid. So reflux is a way of life. There's nothing that you can do in terms of treatment other than time and the baby getting more mature. So, no, I mean, so if, yeah,
We have some-
upright for sure. So there are things that we can do to help. And so it kind of just depends on what is the clinical manifestation of what the reflux is doing. Is the reflux the milk coming out of the nose after every feeding, about 30 minutes to an hour after the baby's fed? In the NICU, is it they're dropping their oxygen saturation or their heart rate or things like that? But if it's really kind of impairing their ability to go to sleep and stay asleep for that kind of period of time, the different things we can do is upright is the number one thing. Keeping them upright right after the feed for like the first hour or so. And then there are some medications that can help, and sometimes we even need to change the formula. These are all things your pediatrician can help with, but obviously if there's specific questions about what is going on with the baby, I'm happy to answer. I can be reached by email through the foundation too. I'll make sure you have my information. But so right now, how is it kind of a problem?
So he's on type 6 and
He does have, okay.
and there's just like even half an hour past and we're not laying him down and stuff, right? You're holding him and he's still like flowing out of his.
Yeah, so how much is he eating? That's the other thing too. Is he taking a ton or is he just getting...
Sometimes like it can be either like a little bit, he'll have like 30 cc's or he'll have like 60 cc's. It doesn't matter if you're small or larger amounts. He's still coming out.
Okay.
Either it's formula or anything.
We're going to talk about nutrition and what babies are getting discharged on, but what is his nutritional regimen right now? Like what is he on in terms of what's he feeding? So, do you find that he's better with one or the other? He hates the Alicare. Yeah. So that can be problematic, especially because the Alicare is one of those formulas that's kind of partially broken down. Formula smells disgusting. I'm sure you guys have all smelled it. It's gross. When I was in training, we would have to taste all these different things. It tastes gross. Babies don't so much have taste preferences, but they definitely like breast milk best.
If you can get the premix, it's gentler on the stomach and it tastes better.
So it doesn't come in that. There's no ready to feed in the Alicare. Yeah. Let's talk offline about this because the question that I have in my mind is if he has a true milk protein allergy, and then we need to look at his growth and see what's happening with growth. So we'll talk after all this is over about his nutrition specifically, but we can come up with some strategies to make it better. Prevacid? Yeah. There's no, if you, there's no evidence in the literature that these medications make reflux better. The only thing that's proven to make reflux better is time. So all these other things that we're doing, there's strategies to try and ameliorate it a little bit, but it's not going to fix the underlying problem until the sphincter tightens, which just takes time. So we'll figure some stuff out to see if we can make it better. Do you guys have any questions about sleep and positioning, and what are you guys doing in terms of positioning your kids for the sleep?
He kind of like lets it spill, like turns his head, and
Mm-hmm.
on the morning I'll see like his getting up to the spilling,
So he's having his spit ups after the 30-minute window.
So I guess it's just saliva though.
Uh-huh.
Is it like every time?
I think you should, the wedge is probably going to be a good idea. I know your pediatrician said no, but I think the wedge is going to be a better idea because it goes under the mattress, so you don't have to worry about, watching while, he's there. But keeping him upright the whole time is probably going to be better. Yeah, we'll talk more about him specifically. Yeah. NICUJenny is the first line formula for reflux. Yeah, it's specifically for reflux, which is usually, even in full-term kids, if they're having some issues with reflux, NICUJenny would be the first thing that we would go to. But I need to go, we'll talk about it. Okay, what about you guys have any issues with putting them down or positioning? No? Oh, great.
We watch them, from our room. But the nursery is right next door.
Yeah.
But they're in the nursery in their crib.
Okay, good.
I believe it's
Good.
5 to 7 hours. So you'll be there.
That's good. Is there any more
Yeah, so I think we talked about some of these things, but it's starting to become winter. We probably have the heater on, so you don't need to over swaddle them. And then I know we check temperature every 3 hours in the NICU. You guys don't have to do that at home.
Oh, yes, you do.
Maybe once in a while if you feel like they're warm or something, but other than that, you don't need to. And then so you want to keep the room temp 62 to, or sorry, that's not correct, 68 to 72. You want to keep the lights low and avoid stimulating during diaper changes, so that they don't wake up. I know it's tempting to, you want to talk to them and stuff, but just turn on the night light, change their diaper, and then that they know this is bedtime. Because babies are very intuitive, so also you don't want to keep baby up during the day, I'm just going to keep them up during the day so they sleep at night, and then they're going to be all disoriented and screaming, so you don't want to do that. Keep a designated sleep area for the baby, whether it's the nursery or your room, so that they know okay, this is a quiet area. Close the blinds. And it's okay to have a white noise machine, but just make sure the area is quiet. And it's good to establish a bedtime routine. I recommended maybe doing a bath at nighttime instead of daytime. I don't know if you guys have experienced that. And reading a book, so that they kind of know okay, this is the routine. We take a bath, we eat a bottle, we read, and then it's time for bed now. And it's good for their brain development too. And it helps you bond with your baby. And then, so we already talked about some of this, but babies with reflux, burp baby after the feed and keep them upright for at least 30 minutes. This is a good time to do reading a book or something like that. Raising the head of the bed, and we talked about, you can either use a wedge like this, or you can use a boppy. You guys probably have that too. at home.
They actually
And-
make a reflux boppy now. I
Oh.
saw it in Target the other day. So it's not the breastfeeding boppy, it's the positioning the baby boppy. It looks kind of similar. I think they're just trying to get
the same thing.
it looks like the same thing to
They're
me.
capitalizing on
Right?
it.
Why not?
And then, yeah, pacifiers can help with the downward contractions of the esophagus, because when they suck, it prompts them to, the motility moves downwards.
Would you suggest getting a pacifier after eating? Just to kind of
Oh my gosh, that helps so much.
Yeah.
And I didn't realize it actually, you should try that.
Yeah.
And it helps so much.
Another
As soon
tip.
as I stop feeding, I just put the pacifier. You can see the smile on his face when you put the
they're
pacifier.
slowing the saliva down.
Yeah.
Yeah. And I think that's all. Do you guys have any other questions?
When is reflux like? When is it kind of like a red flag? Like, hey, this is more than just like normal reflux. This is like something
Like
there should be-
projectile vomiting? Like,
Or it's too much, or it's
Yeah.
So the biggest marker is going to be is the baby gaining weight? You know, so you have such thing, we call it a happy spitter, and it can be a full-term kid or a preterm baby who has reflux and just seems to projectile 80% of the volume, but is growing nicely along the growth curve. There's nothing you can do but wait that out, and then the baby seems fine. It's if you're losing weight or crossing your growth percentiles, and especially for a preterm baby, because we're trying to pack the pounds on so they catch up, it's really about the weight gain, that we want to make sure the weight gain is going well. So if that means more frequent weight checks at the pediatrician's office, just to make sure that we're still on the pathway, then I think that's what that should be done. No, you can have a scale at home. Well, as long as you're using the same one, like you're using the same one and you see that we're gaining weight, then I think that would be fine. Sure. It's the most important thing, making sure that we're gaining weight. Yeah.